Macey.
Hello.
How are you doing today?
I'm doing well. How are you?
Pretty good.
Good.
I'm happy to have you here for our Art and Healing episode, where we're exploring different stories of women entrepreneurs and just leaders in the community who are having a positive impact with their gifts. I'm so proud to have been able to have had you as my optometrist for the past 8 years. And I know I've learned a lot about my eyes, and you've helped me take care of them over the past 8 years. And so I just want to first start off by saying thank you for all the great work you're doing as an optometrist in Tampa Bay. So
thank you.
I would love to learn more about you and your practice. If you can introduce yourself, tell us your name, your title, and tell us about Moderneyes.
Well, I'm Dr. Macey McAleer. I'm the owner of Moderneyes Advanced Eyecare. We opened in April of this year, 2025. It was a long time coming. I've been practicing in the area since 2007, so I've been building up a nice patient base, getting to know everybody in the community, and it was just time to do this for myself. There's a lot of eye care that I want to provide to people that I either was limited with my equipment or the ability to have my own optical, and it was just time to get the message out and start helping my own population.
Amazing. I love that. So can you tell us a little bit about your journey? Why did you choose to go into optometry? What do you love about the eyes?
So I get this question a lot with my patients, and I tell them I think I probably could have been a doctor of many things because I'm kind of passionate about the entire body, but how ironic it is that the eye is connected to the whole body. So it kind of satisfies that need to continue education on everything in your body because it can show up in your eye. And so in a way, I kind of picked the best career because I can manage your systemic conditions, I can manage your eye conditions, but also one of the things I love the most about it is that it's a family-friendly doctorate industry where my family has always come first in my career, and I feel very fortunate that I found something that I can love that also caters to my home life.
Oh, I love that. And why is it so important to you to have a family first practice? Like, what does it mean in today's day and age, especially from a doctor's perspective? What does it look like to see your patients as more than just a number and wanting to be invested in their health?
So I think it's very valuable, especially nowadays where we may go into our doctor visits and we may not feel heard. We may not feel like our complaints or our problems were addressed in the way that we had hoped they were. And when you come to see me, you'll have a full experience of starting the conversation with you, listening to how you got to be where you are as far as your visual needs, as far as your problems coming in. And I find that the majority of my exam happens in the conversation. You can find out a lot about someone if you just talk to them for a minute. And with the family approach and the more invested I get to become in you and all your family, it provides better eye care because you have to know what's happening with a person, with their family, to piece together all the puzzle pieces to make sure that they get the best vision and preventative eye care in the long run. And I just want people to know that they have a consistent face that they'll see when they come in. They don't have to re-explain themselves every time they visit. We're going to pick up right where you left off last time, and it will be that way for everybody in your family.
Wow, that's beautiful. And I will say, as somebody who has been seeing you for the past 8 years, as a patient, one of my favorite things about being able to work with you is that you're so human first. Like, you're very personable, you're very friendly, down to earth, and you don't always get that experience with a doctor. It feels like I get to go to the eye doctor and like go see a friend of mine. And
yeah,
so
definitely.
I just want to say, like, the way you show up for your patients is very beautiful because it makes it feel welcoming. It makes it feel like you're being taken care of. So like I've heard other patients say the same about you. So why is it important for you as a doctor to bring that type of energy to the patient experience?
You know, it's as much about you guys as it is about me. I enjoy that time too. Yeah. I have done optometry a long time. You know, in the beginning when you just graduate, you kind of feel nervous because you're like, oh my gosh, I have to learn all this stuff. I have to get this under my belt. But now I'm comfortable with optometry. My day is made when my familiar faces come in. And that keeps me going in my career. It's about picking up again, like I said, the last time I saw you. I not only know about your eyes, but I may know about you buying a home. I may know about you expanding your family. We pick up and we have just such a good time, and then having a good staff also, so that we can carry that good time onto the optical floor. It just makes everyone have a great experience. And honestly, right, it's just fun every time you come in.
Absolutely, absolutely. And I feel like that's one of your strengths as a doctor, to being able to create that type of experience. So when it comes to optometry, for somebody who doesn't know much about the eyes, all you know is you read some letters on a paper and bada bing, bada boom, you have glasses. What is there to optometry that both younger generations and older generations can just better understand the importance of having those annual eye exams, having your eyes dilated so you can see the
back of the eye, the
back
retina.
of the eye, retina. Can you tell us a little bit about the importance of that?
I'd say a huge majority of people don't know until they know. And a lot of times that happens when something goes wrong. And then you come in and you're like, wow, I didn't know that could even happen. Awareness is so needed right now about how much we can intervene with the health of your life. We do not grow up knowing that just because you can see, means that you're okay. Like, there's a lot of conditions that you cannot see, you cannot feel. And the way I go about kind of gripping people in that moment is when I see them for an exam, and if anything is off on their eye, which happens in almost every patient, you can almost find something different in every patient, I'll bring it up and I will tell them in reverse how it got there. And they will have not told me any of it. They didn't put it on their intake form. They didn't think it was important. They didn't list their medications. I'm like, I can tell them exactly what medication they're taking because it's showing up in their eyes. And then they're like, wow. And not only are they wow, they're like, I'm going to tell my family about this, because it's no joke that the eyes are the gateway. And I thoroughly enjoy getting involved with a patient that wants to hear it and wants to learn and grow from it. And sometimes we have good things to say. It's not always bad things, but or it's a patient that's had headaches forever and their prescription was just a little too strong and I lowered it, which a lot of times, they just stay the same prescription for a while, and I take this gutsy move to try to lower it and their headaches go away. There's just a lot of satisfaction in helping people, whether it's vision or ocular disease or anything, and watching people become better contact lens wearers. It just starts at the foundation, just getting to the root core of why you're blurry and why these things happen is my favorite thing to do.
Yeah. So when you say the eye is the gateway, can you tell us a little bit more about that? Like, what types of things can you see in the eye? What beyond just the eye can you see with the body when it comes to?
So there's a million things, but if I had to, let's start like front to back. So in your eyelids, I can tell a lot about your diet. I can tell a lot about the condition of your overall skin. Inflammation is, prominent in the lids. How I can tell a lot of times if you're in your 20s and you sit on a computer all day by the way your oil glands look in your lids. They look different now that we're moving towards this digital age. 20-something-year-olds should not have anything going wrong with their lids, and they're starting to look like they are, the glands are, we say atrophying, or, they're not functional, they're not producing, there's inflammation on their lid margin, and that literally comes from not blinking. Blinking is one of the most important things we do every day to clear out irritations and keep our glands open and things like that. So that's the lids. Then you go to the conjunctiva, which is the covering of the white part of your eye. I can tell if you're a Florida person because a lot of younger people have inflammation all over their conjunctiva. They have changes to the tissue that are from UV damage. So we can talk about that. And then you go to the cornea. It shows the first thing that most people have that people have no idea is cholesterol deposits in the front surface of the eye, the cornea. And I tell them it doesn't affect your eye like that. Don't panic, but you do need to get your labs done. And that can happen. I can see it with the tracest amount in the microscope. Then it goes into, the iris, and that tells me, all sorts of things about traumas or autoimmune conditions, the lens of the eye with cataracts and different deposits of, lipids and things like that. And then it goes into the vitreous, which is the liquid of the eye. I had a patient this past week that I'm pretty certain just changed a medication, and it caused the vitreous of his eye to separate from the back. And it was a heart medication. And it's deep down in the research about how it affects fibrin and collagen in your body. So it just goes on. And the retina is just connected to the whole part of your body. So whether you have diabetes, blood pressure, there could be autoimmune conditions. I mean, the retina, if your arteries and veins are inflamed, if you break a bone, you can see it in your retina sometimes. There's a lot that the eye can tell you, start to finish, and every single layer that can give away a piece of the puzzle that maybe another doctor can't figure out, which is awesome.
That is awesome.
Yeah.
Like, that's the part that's, for me, is like the science, like that the eye can tell you so much. It's kind of similar probably to like the spine for like a chiropractor, being able to see how it connects to everything else in the body. But like the eye, it's like that's something I never thought of until you told me. And until I got the dilation and you were able to take that really cool picture of my retina and help me see, and kind of like it's an educational experience too, where you're teaching us, okay, this is the part of your retina. You tell me about the glossy part as well. Glossy? Yeah. So yeah, I just think it's so fascinating, the science behind the work that you do. So with everything that you just shared, can you tell me a little bit about with advanced eye care? How is this different from like your everyday eye doctor that you could go to versus being able to get that advanced care that helps you learn about these things, especially for like maybe older generations?
Sure. So I think one of the biggest things you'll notice when you come in for your exam is the pre-testing is a little more extensive. We don't just do a couple of pieces of equipment. You get a standardized autorefraction, a standardized topography, which is like a map. This isn't making a lot of sense, but the autorefraction is where we check the prescription to give us a baseline when we start. It tells us like the shape of the cornea on the outside. There's a standardized topography, which is a map of the front surface that I can look for any diseases. If anything doesn't seem to be going right in your prescription check, I can see if the contact lens wear has been affecting your eyes. Then we go into a visual field test, which is definitely not standard on an incoming regular routine eye exam. It's a screener that, it's a little video game that tells me about the retinal sensitivity all in the back of your eye to make sure there's no blunt things going on that I need to go into further. I've actually diagnosed a pituitary tumor on that machine. So it's very, very useful, and it's 30 seconds an eye, easy peasy. I do the wide field retinal imaging on every patient, so that gives me a 200-degree view of the back of the eye before we even get started, that I am allowed to put filters on. I can zoom in, I can look a little closer, and I don't have to be blinding you with lights in your eyes. It's very, very helpful to do preventative care and to monitor a moment in time, so we can always compare from this moment on to see if anything changes sooner. And then in the exam lanes, we have digital phoropters, which just the digital charts with the phoropters provide crisp vision in a way that some of the older technology charts just don't grab. Like the lighting in them are a little bit fuzzy, or you might need a little more prescription to see it well when really you didn't need that in the first place. So it allows for better prescriptions. And then the contact lenses, the materials we have for sale, they're all just they offer an array of just good to great. There's nothing in here that's inferior that you may take home and it not be worth its while.
Can you tell us a little bit about your patients? So I know that behind the scenes you have children that you work with and all the way up to elderly people. So can you tell us a little bit about, especially the younger generation and the older generation, the type of work that you do in those spaces?
Traditionally, yes. Women and men over the age of 40 start getting into a different demographic of disease population. You will have people that have diseases in different decades up to that point, but those are going to be more like genetic from childhood on, and they've been taking care of those throughout time. When you get to this point, a lot of it is you are given these genetics, but what can we do to not activate them? What can we do to prevent them from being the most severe form of them? We can really manipulate, right, with epigenetics and all that. We can really manipulate the outcome of macular degeneration. And diabetes, as we know, is not always reversible. Even the best, sometimes their genetics will, affect their diagnoses, but preventing them from having effects of damaging diabetes is possible. So it's about managing the new conditions that come up, detecting them as early as we can instead of coming in later in life when they're already manifesting symptoms, and making sure that we take care of them early. And also just having the compassion to walk through presbyopia, which is when you lose that ability to read up close in your 40s. That's a big life change. And if you haven't been keeping up with the eye doctor, you may not know what's coming. You're concerned, you're worried. And I find that just 40 to 60 in general is just a huge pivotal moment in everybody's life. And then it goes into maintenance mode and just making sure that we hold still everything that we can until, your long life is passed on. So,
okay, perfect. And then can you also tell us about what you offer here? So you walked us through kind of what the testing looks like. Once they're done with the test, what does that look like afterwards? That you being able to show them, or your team being able to show them the different glasses options, contact lenses. Can you tell us what options you have here?
So when you finish with your exam, I will escort you out to the optical where you'll meet with my optician, and they will guide you through your visual needs after I have kind of passed on what you've told me in the exam. They go through the different frames, make sure you're picking ones out that fit you well. They measure them, directly to you with them on your face to make sure the best optical quality is obtained. We have amazing lens options for all patients depending on your prescription type and what materials you might need. And then the contact lens selection is an array of different choices that I have during the exam to make sure that you get in the right fit and have the best vision.
So I'm so thankful for you and our conversation today. Thank you for sharing a little bit behind the scenes of what it looks like to be an optometrist and the work that you do and why you put so much heart and care into the work that you do. I'm very proud of you. I've seen your growth over the years, and for you to have your own practice. That I know it takes a lot as an entrepreneur to take a chance on your own dream, and you literally have it. Like the most beautiful practice I could have ever imagined. I remember you telling me about it before it was here, and now it's here. So I just want to say congratulations, because I know it took a lot to get here, and you're here now, and now you get to share your story and your passion.
Thank you. I really appreciate that, and I appreciate you coming on the journey with me.
Yeah,
Thank you.
Absolutely.